in the endocrine world, because we are seeing significant improvement in both glycemic control. So blood sugar levels are improving, and we're also seeing some weight loss with this class of medication. So that I do like the class in general. I do think that the class works very well for controlling diabetes, but also for those people who struggle with weight, this class is very good for them as well. Another topic, I wrote some other questions down that you guys have been asking me. Another one is, why is your continuous glucose monitor not always right? And it's not that it's not right. Okay, so I'll go back to that. But Yoda, very good question. How long can people stay on Ozempic or Mounjaro or Trulicity, any of those injectable medications? That's a very good question. So you can stay on them pretty much for lifelong. There's no data to show that we have to discontinue the GLP class. So once we start a patient on that class, we try to keep them if we don't need to take them off it. So let's just say a patient starts Ozempic and they drop 40 pounds, which I've had happen to me, but the patient also made lifestyle changes. Now they're exercising regularly, they're eating better. So they're making all these lifestyle changes. I will start to wean them off Ozempic or the Mounjaro, and I gradually decrease the dose the same way that I initially increased it. And I try to, work with the patient to make sure we can maintain the weight. Unfortunately, it's hard because what happens with this class of medication is a lot of people will regain a lot of the weight within the year. So let's just say you lost 20 pounds on Ozempic. Once you stop Ozempic, if you don't really work hard, you can regain that weight back. And that's the problem with the class of medication. We know they're very powerful, but only when you are willing. Exactly. So Yoda, that's a very good thing. It's lifestyle. I cannot overemphasize. We are a product of what we eat and what we do. So if we're not active and we're not, eating the right things, no matter what, there's no magic pill that can do what exercise and dieting can do for us. So for that reason, it doesn't replace exercise and it doesn't replace proper dieting. We should supplement it. So we use this class of medication when the patient is really having a hard time, even when they are trying to make the lifestyle changes and they're not seeing the lifestyle changes work as well. So that's a very good question. I do like the class of medication. It has been a revolutionary change in the healthcare system, because for the first time we have a class that's not only lowering blood pressure, but it's also helping with weight loss. But again, it's not like we want to throw this medication on people. We always want to push the patient to do their most that they can do. And if that doesn't work, then we would add this class of medication, because we know everything comes with side effects. So nothing is free, unfortunately. Even drinking too much water can have a side effect. So we want to make sure we're cautious. Some of them, very good questions, Yoda. I hope I'm saying your name right. I apologize if I'm not. Some of them mention the risk of thyroid cancer. How probable is it to get the cancer? Very good question. Another thing is, we want to be careful how we use that term. It's not cancer, it's medullary thyroid cancer particularly. So medullary thyroid cancer, fortunately, it's already rare, which is good, because we don't want, medullary to be more prominent, more prevalent than that. So the chances are very low. I want to say even lower than 1% probable. But if we have a patient that has a history of medullary thyroid cancer or a family history, we don't want to even give them 1% chance of getting it. For that reason, is discouraged, and it's a black box warning on this whole class of medication. But it's not papillary thyroid cancer, which is the most common. We're talking specifically for medullary thyroid cancer, which is a more rare form of thyroid cancer. So usually if the patient doesn't have a history of it or the family history of it, it's not a huge concern, because when they did the studies, it was a very low probability anyways. So it doesn't scare us from prescribing it, and it doesn't scare patients either when we tell them that, we're talking about medullary here, not papillary, which is more common form of thyroid cancer. So very good question. Absolutely, that's one of the risks that we take is medullary thyroid cancer. So that's a good thing. So I'm happy about that. But again, it's we always want to weigh the risk versus benefit. If something is going to put the patient at higher risk and give them a less benefit, then it's a no. The answer is no, you should not go on it. But if you're going to benefit so much more, maybe reverse prediabetes, reverse obesity, fix your fatty liver, because we know that Ozempic is working great for fatty liver. And actually, here at Yale in Connecticut, Yale Hospital is doing so much research with fatty liver and Ozempic. So when we know that we're fixing so much more than the possibility of a very low risk, then that's worth going for, because we're fixing that patient so many major issues that can cause so many issues in the long run, that the very low risk of something is usually underweighs the pros. So I hope that makes sense. It's always risk versus benefit. If those two are coming close to each other, the answer is you should not be on a medication, period. But if the pros are here and the risk is like negative, I would say go for it, because the chances are way too minuscule for you to be worried about that. So I did want to go back to one of the other questions that you guys been asking me, and it's about CGMs, continuous glucose monitors, like the Dexcom or the Freestyle Libre. And the question was, why are those not always accurate to a finger stick? The reason why is because CGMs are measuring your serous fluid. So they're going inside the fat tissue. They're measuring that fluid in interstitial fluid, whereas your finger stick is your blood. So think of a CGM like the back of a train. It will eventually get to the same place, but it just takes a little bit longer. So it's going to always be a few minutes behind. But for any case where you're feeling like you need to correct it, if you're on insulin, you should always go by a finger stick, because that is always going to be more accurate, and you should not follow the CGM at that point if you're depending on it for an insulin administration or anything like that. So this is great, guys. I just kind of wanted to say hello to all of you who support my channel. I have a lot more content and a lot more videos that I worked on today, and I think you guys are going to enjoy them. If there's anything in particular that you guys need, you guys can always message me or comment on the videos below, because I'm always so glad to answer all of your questions. And by the way, you guys have the best questions. You guys are so smart and so knowledgeable that it is really inspiring to see. So keep it up. And anything you guys need, please let me know. Otherwise, I am going to try to do some more of these lives, so you guys can kind of get to know how I work, how I manage patients. Luckily, we've had so much success with diabetes management, and I truly mean it. This is probably the best time to be a diabetic, because we have so much more education, so much more newer medications, so much newer products like continuous glucose monitors. I mean, guys, we used to check glucose patients, how they're being managed through the urine. And now, of course, we can check through finger sticks, we can check through CGMs, A1Cs. So we've come such a long way, and there's so much more coming up. Hi, Rick. Thanks for joining us today. Are there more affordable CGMs in the pipeline? So good question. Not more affordable, meaning the actual CGMs are not going to change. But what's happening right now is insurance companies, because the demand is so high here in the United States and actually worldwide. So the insurance companies are really starting to see that this is helping patients. It's helping reduce complications. It's making management so much easier. And when we can manage patients better, obviously the cost of the insurance goes down. So they're spending less money on patients. What do I think is going to happen? I think every diabetic is going to be able to get a CGM in the next 2-3 years at a very, very, very low cost. And that competition between Dexcom and Freestyle Libre, they're like fighting with each other. So they're always working on new things that they can make customers more likely to use them. So what they're doing is they're paying down, they're doing like pay down. You pay an X amount and the company pays everything else. So I do believe that it's going to be extremely inexpensive very, very soon. So stay tuned. I know the cost is such a problem, but remember, if you're on the Freestyle Libre, you should not be paying more than $75 a month for the two sensors that you get per month. So if you are paying more than that, you need to contact Freestyle Libre, and they will pay down everything down to $75. So it's still not a great price, but it is better than 150 or 200 that some pharmacies are asking. So if they're asking you for that much, you should not pay that price. Call Freestyle Libre, and they will definitely pay it down to 75. So not great. Like I said, I want to get that down to zero. I do think that's in the works. So I don't think that's going to take very long to happen. I really truly see that in the near future, because we've gone from hundreds already down to 75, and we're working probably close to $0, because a lot of these medications are actually going down to zero, because the demand is so high, and insurance companies are just saying, okay, forget it. Let's just give it to them, because the demand is what drives everything. So once again, guys, thanks for all the wonderful questions. I am going to do more of these lives here on YouTube. If you guys have any other questions, feel free to ask me now. You're welcome. And you've had so many good questions today. So I really appreciate all of your engagement today. All of you guys have been wonderful, and I really enjoyed doing this. So if you guys have any other questions, let me know. Otherwise, I will probably do another one Sunday, and hopefully more of you guys will be available too, so I can answer even more questions. But it's always nice to hear your feedback, because it not only helps me realize what you guys need, but you guys also help other viewers as well by giving your feedback, which is always great. So I hope you guys have a wonderful weekend. Have fun, enjoy. I hope the weather is great wherever you are. Maybe go for a nice walk. We know that walking or exercise helps our blood sugars tremendously, but not only that, it helps the circulation, it helps control diabetes, it helps our mental health, we sleep better. I mean, everything is better when we exercise. So once again, guys, thank you so much. Take care, and I will see you guys most likely on Sunday. Take it easy, guys.